Going live now.
There we go.
Yay. Awesome.
All right.
Done on a
Excellent. Technology will not defeat us tonight. All right. Fantastic. Good evening, everyone. I'd like to call to order the Community Services Committee of the Norwalk Common Council meeting for Thursday, May 18th. With us, members of the committee, we have Mr. Greg Burnett, Ms. Barbara Smith, Ms. Nicole Ayers, and Ms. Diana Revolus. So we do have a quorum. I guess we'll move to public comment. So do we have anyone that is, I don't see anyone in the attendees list that would wish to address the committee. Is there any member of the committee who has received any correspondence or anyone from staff that would need to be read into the record tonight? Hearing none, I think we can close public comment and move on to approval of the minutes from the meeting held March 16th, 2023. Can I have a motion? Thank you. Thank you, Ms. Smith. So are there any additions, emendations, corrections to the minutes? All right. Seeing or hearing none, I think we can call for a vote on the approval of the minutes from March 16th. All in favor, please signify by raising your hand. And opposed? Abstentions? Motion carries unanimously. Minutes accepted. Great. We'll move on to.
There's one abstention.
Oh, I'm sorry. Abstention.
Burnett.
Sorry,
yes.
Correct that. So that would be abstention from Mr. Greg Burnett. Next, we have discussion for updates from the health department, and I will turn it over to Ms. Deanna Diamore.
Good evening. So we wanted to give a quick update related to COVID. May 11th marked the end of the COVID-19 public health emergency. And so we wanted to, Brian's going to give some quick surveillance updates, but we just wanted to let you know that, while the public health emergency declaration has ended, COVID still will remain, but we'll be keeping a close eye on it. And so it's no longer an emergency situation, but we will be continuing to monitoring it on our end, and we will keep you all informed. The Commissioner of Health had a press conference with the governor and several others where they discussed the end of the public health emergency and what that means for Connecticut. While many of the resources that have been dedicated to the response have, the mobile vaccination clinics, the testing, most of those will be transitioning to, the traditional healthcare model. We still will be working closely with the state health department. We'll still be looking at the latest updates related to vaccination. So we'll keep you all updated with that. But I wanted to pass it on to Brian to just give a little update on the surveillance before we move on. Thanks, Brian.
Yeah, thank you, Deanna. Thank you, everybody. Good evening. All right, so I'm going to kind of do this a little bit like an auctioneer, but you guys kind of seen this already, just so I can cover all the topics. There's 3 topics I want to cover. It's, the respiratory illness and Mpox, and then also just tick surveillance really quickly. So I'm just going to try and move quickly just because of the packed agenda. So try to hang tight. So with that said, this is the COVID data hub. It will be updated, obviously, in lieu of the public health emergency kind of having concluded. But what you're seeing here is what I usually show, which is the COVID-19 hospitalized patient census by Connecticut County. As you can see right now, for the data that's just been updated for May 18th, we're only at 46 COVID-associated hospitalization patient census for the state of Connecticut, which is really phenomenal. As you can see, Fairfield County is at 11, which is the second highest behind New Haven County at 17 and Hartford County at 11 as well. But you can see how we peaked in January 2023, and we're at the very low kind of new baseline numbers when you compare us to even the 2022 year, where it was not really kind of that low. So it's, again, very good news in terms of what we're experiencing relative to the severity or hospitalizations for COVID-19. And then if you look at it for wastewater monitoring for Fairfield County, similar scenario in terms of just very low activity, almost close to, establishing essentially a new baseline, and it's holding steady for now. So it's very good news. As an update, with the CDC, as well as all the other public health agencies adjusting because of the end of the public health declaration, the CDC COVID-19 community levels have also concluded. And so they've been modified now from the CDC really to look at just the hospitalization, numbers, just like kind of what we're doing here with the COVID data hub, but the COVID hospitalization emission levels by county. And so you can see when you factor in this metric, just to kind of, again, monitor for severity and any sort of upticks. Right now, everything's pretty mild for the whole country in general. As you can see in the low or the green, which is less than 10, COVID-19 hospital admissions per 100,000 of the population. The whole Northeast is in the green by county. It's really only kind of the Midwest and kind of the South and a little bit of the Southwest that you see kind of like a medium or a high activity for some counties. But overall, very good spot and very good place to be, especially for the summertime right now. With that said, we still want to keep an eye on anything that can kind of change that, situation. And so we look at the subvariants of Omicron that are still kind of, again, running the show, large proportion still being XBB 1.5. But we have a few others that kind of split off from the XBB family. XBB 116, XBB 191, XBB 192, XBB 23, and XBB 151. As you can see, they kind of all add up to this, as you can see here, the blue color for the bluish purplish color for XBB 1.5, but you can see like below that, all the other different bluish and purple hues and even a pink hue. And those are the other subvariants that we've got to keep an eye on because especially with XBB 116 and XBB 191, they have grown a larger proportion at about 14.3% and 9.2% respectively, and even 192 at 4%. So as you can see, regionally speaking, all the country, all the regions in the state of in the United States are getting impacted in some way. But as you can see, region 2, which is usually more indicative of our situation, even though it's more like New York, New Jersey, but given our proximity, you can see about a third of that picture is these new subvariants entering the picture that are changing that proportion. And so naturally, as with any kind of, introduction or growth prevalence in terms of any of these subvariants, there are kind of like, as I qualify as collateral damage, where you do have cases, potentially an uptick or not. But right now, fortunately, it's not indicative of that for Fairfield County with the and for Norwalk, as you saw with the other data. So very good news. And again, just looking at forecasting. So this is a natural forecasting model for COVID, and it's pretty much, again, showing kind of things with being kind of level, which is very good news. No uptick, no downtick, really, more or less. And you can see that apparent for the state of Connecticut with just a little bump here near kind of like the beginning of June, near the end of May. And so that's just, a little kind of, pretty much more or less, again, showing the same situation there. So influenza, just the thing that kind of hit home here is Connecticut's still in kind of like the higher part of minimal activity for flu, but then New York City is still at moderate activity when it comes to the Northeast. So that's something just obviously to kind of keep in mind. And that's also indicative by this data from the state of Connecticut, where if you look at the bottom here, these are the number of flu cases that are still occurring. It's a very, very minimal number, but it is type B influenza that seems to be still playing out, not so much type A. And you can look at it from the hospitalization standpoint and incredibly minimal numbers. You're talking about just a handful, if not less, hospitalizations associated with influenza thus far with this stage of the season. So again, good news, and again, supporting with the good weather that we're experiencing. And you can see that kind of indicative even with also RSV, along with COVID-19 influenza with those low numbers nationally speaking. Now, switching gears, Mpox or monkeypox, as it used to be called, a reference. There has been a cluster detected, and this was noted in Chicago. It's a cluster of about a dozen individuals, and potentially, more, as obviously more surveillance continues relative to that situation. The point to hit home again is with Mpox, because we are in the summertime, and keep in mind we had our last outbreak of Mpox during the summertime as well because of increased social activities. We want to just get the word out there, and so. Again, you can see how where we were back in 2022, you can see the curve here, where especially peaked around, late July, early August. We're nowhere near that right now. It's very sporadic, these number of cases, but it's something we want to just ensure everybody is still mindful of and in that prevention mindset so we don't have a repeat of last year. And again, that ties to prevention measures. Big one being the vaccine that does exist, the Jynneos vaccine for smallpox, which also cross protects against Mpox, and it's definitely very effective. It's proven in terms of literature. It's just that those individuals that may be at greater risk of contracting the illness, that making sure that they're up to date with that vaccine. And so again, it's a 2-dose vaccine series, so that means getting those 2 doses to really ensure that the full protection. And it's for those that might be a high risk. So generally speaking, especially from the state of Connecticut, from the outbreak from the prior year, looking at that data, about 90% or so was related to men who have sex with men, generally speaking. And so again, this also is tied to anybody that may have multiple sex partners, especially where there might be limited protection, things of that nature, kind of just, getting to the more peripheral side of this. And so it's really important, anybody that might be also considering themselves at risk, that they could follow up using these CDC links right here, where you can find a clinic within your area, finds it within a radius of 25 miles or whatever it is you set here by your zip code. And they can get the vaccine, just to ensure, really adequate protection, especially, if somebody should contract the illness, reducing that severity of illness as well. And so again, if somebody is sick, obviously following up with their medical provider is going to be really important. One of the, there's obviously prodromal symptoms, that are very generic, like fever, body aches, things like that. But then it does manifest in the noticeable lesions, the rash, that's going to manifest on one's skin, and that's what's suggestive of definitely following up with one's doctor. And with those lesions, those could be tested to determine if it actually truly is related to Mpox, because there are other diseases that may manifest similarly. So that's just really important. And again, so that's to my point, if somebody is suspected that they're close contact to somebody with Mpox, there's a 21-day kind of monitoring period from that last date exposure. They just need to keep an eye out for these kind of symptoms, like as I mentioned, fever, chills, muscle body aches, headaches, swollen lymph nodes, respiratory symptoms that may be related. And then obviously, keeping an eye out for that characteristic rash, and that rash will present to somebody obviously, is actually infected with the illness. And so again, prevention is the name of the game. So that also means not only the vaccine, but also practicing, common sense measures, when it comes to, that close intimate contact that would help with that transmission. And obviously whenever you're kind of just, having intimate contact with anybody. So it's just, just kind of those things to be mindful of in terms of protecting oneself, and mitigating the opportunity that the transmission can occur, because subsequently that helps all of us, so we don't have an outbreak or any other kind of situation that we have to kind of be mindful of, and also just ensuring that, one doesn't, experience any other kind of severe outcomes related to this. So then that's that. And then switching gears to tick-borne surveillance really quickly. This is just the webpage from the health department in regards to just tick prevention. We want to be mindful of this. Generally speaking, again, it's just avoiding areas where, one might run the risk of getting exposed to ticks, which again, be more, heavily, heavy vegetation areas, including especially the woods, with large bushes, things like that, and running across that. And then also wearing proper clothing that will protect oneself, like tucking your pants into your socks, wearing closed-toed shoes, wearing long pants, long sleeve shirts, where appropriate, obviously, with your activities and relative to the weather as well. But the other really important thing, a very helpful thing, is the insect repellents, and making sure it's EPA, the Environmental Protection Agency list approved or registered. So it's definitely demonstrated to be effective as an insect repellent against ticks. And then also, checking yourself afterwards. And then more importantly, as I like to also emphasize, checking your pets too, if you're taking your pets out. So I think that's also really important, and just checking your pets around areas that, because again, pets have a lot of fur typically, around the ears, around the eyelids, underneath the collars, behind the legs, the toes, the tail, things like that, just to make sure that your pet also didn't pick it up as well. Because again, keep in mind, they're lower to the ground. They also move around spaces that humans typically may not interact with. And so there's more opportunity to pick up ticks that way too. So I think that's really important, because as you can see here, this is tick surveillance for 2022 for the adult female Ixodes scapularis, infection rates of the deer ticks. And basically, more or less, the surveillance that occurred here, and this is relative to Westport, the Connecticut Agricultural Experiment Station, conducted with the specimens that they received, almost 50% of those ticks were infected with Lyme disease. So this is the point to really emphasize here. And again, these are the adult female, like deer ticks, and this is data relative to 2022, but of those specimens collected, about 50% had Lyme disease. So there's already the increased risk for that. But there's other pathogens that we have to be concerned about, anaplasmosis, babesiosis, even Powassan virus, things of that nature that we want to be mindful of. And, generally speaking, there's a very low percentage of ticks that demonstrated, that were infected with that, but there still is a proportion. And so the point is, again, prevention. That's the name of the game. That goes to COVID, that goes to Mpox, that goes to ticks. And so we want to just be mindful of that and just get the word out there. Again, there is that risk that some of these ticks, if you get bit, may be carrying, Lyme disease at minimum. And so you just want to make sure you take those prevention measures, check yourself, your pets and things like that, catch it early, follow up with your physician if there's any concern in terms of having been bitten and things of that nature. That's important too. And so again, this also ties to vector-borne disease. So mosquitoes as well, mosquito activity is occurring right now, although it's at the lower stages, but it will pick up as we approach, the end of this month and then consequently into June. So that's another thing to also be mindful of in terms of the prevention game. And so always kind of keep that mindset in mind. And generally speaking, that's kind of the name of a lot of public health in terms of a lot of these infectious diseases. So with that, I'll wrap up right here because I know I already kind of took a little bit more time than expected. So thank you, everybody.
Brian, thank you so much. It's appreciated, the work that you're doing and the information that you're giving us all. So thank you. Appreciate it. Moving on, we have with us tonight Latoya Fernandez, our Chief Diversity, Equity, and Inclusion Officer, and we welcome her this evening. She's since being hired, we haven't had the opportunity to get you back in front of the committee and say hi and welcome, and also find out what's been going on and what you've been doing. So looking forward to your update.
Yeah, awesome. Hi, everyone. It's great to be here. It actually feels so good to come and give this report to y'all and talk to you about what's been happening in the DEI office. It's been a little over 6 months now. And so, I feel like I kind of hopped into a full sprint. Oh, good. You gave me sharing capabilities. So I'm going to share my screen with y'all. And I'm just going to go over a few things before I talk about my kind of most important thing, not most important, but like the biggest item, which is the Equity and Justice for All Commission. So first thing, I started the Language for All program, and actually Greg got to be a part of the class, and it was awesome. We hired a Spanish teacher. We had a 6-week cohort. Really successful. People from all different departments, participated. So it was wonderful to just, be in a space and being vulnerable and learning a new language for everyone. And we're going to continue that program. So we're going to host another 6-week or a 6-week cohort of that class. And we're hoping to do at least 3 per year. And so there will be a survey that comes out soon for the next cohort. I am looking for a Haitian Creole teacher. So if anybody has any thoughts about anyone or any suggestions, please reach out to me because we want to get that going as well. The language access line that the city's been using is now going under the DEI office and going to be a part of my department's budget. So that's another thing. And so with that, I've taken kind of a deep dive into what's happening with folks getting tested to become interpreters, and then, the culture of that. And so we've been able to change some things around, including raising the yearly stipend for our interpreters, and then looking into a different kind of certification process that's gonna not just test people, but prepare them for the test, because there were some issues with the test, the accessibility of the test and the kind of Spanish that's on the test. And also it's on a different coast, it's on the West Coast. So there's been some access issues. So we're actually gonna be moving into using a different certification process that's going to prep people for the test and then allow them to get that certification. Our Spanish teacher is also going to be supporting with that as well. So he'll be running the cohorts, and then we'll be having quarterly sessions where he'll come in and we'll just kind of have like a networking event and we'll just be speaking Spanish. So practicing for fluency and then supporting people who are testing to become interpreters. And so that program is kind of just went in and did, an assessment of that whole program and then gave it a little bit of a facelift. And then the city, we're going to be getting a Babbel subscription, a lifetime subscription, so that employees can access that, learn different languages. They also have, some different modalities of learning, some classes and some different activities there too. So we're expanding that out. The next thing was just around youth. And I want to just kind of preface this by saying that there's a big emphasis on youth right now. There's a lot of things going on with our young people in the community, and for the city, it's a priority for us to make sure that we're providing resources and support, for youth and families, or connecting them to resources and support. And so one of the things in this process are yeah.
No, you froze for a moment there.
Oh, am I good now?
You're back now. Yeah.
Okay, cool.
Sorry.
So we're finding that, can you guys hear me now? Because I just got a message that says my thing is unstable.
Yeah, no, we hear you fine
Okay,
now.
cool.
You
All right,
had
good.
just started talking about the youth.
This is, okay,
Yeah.
great. Yeah, so now, so youth services is now integrated into the expulsion and suspension hearing process, because what we found is that a lot of the kids that are, going into that process reflect the communities that have been, they come from socioeconomically disadvantaged communities, and they're traditionally young boys of color. And did I freeze again?
No, you're good.
Oh, okay. I thought I heard something. All right. So yeah, so we have youth services as a part of that process now. And what's been great about that is we've been able to start connecting families and young people to services that the city has to offer, to programs we have going on, in the youth services department. And I'll tell you, the hearing officer, that's been running those expulsion hearings was really excited with that partnership with the city. And so it's been a really positive thing so far. And then we're working to host a youth civic engagement event. We have our youth advisory board, but I know we want to kind of revamp the mayor's youth advisory board. And then looking at one of the things that keeps coming out in these expulsion hearings too, is that young people are looking, for productive things to do in the community. They want to get involved. So we want to host an event, and in partnership with the commissions. This idea came.
I think we lost
Folks on the
Latoya.
Planning and Zoning Commission who have an interest in engaging youth and talking to them about redevelopment is part of the table. So we want to create pipelines for them to kind of move into these positions as we're thinking about the future. And then just around employee stuff, my office partners a lot with human resources. So I did work with the chief of HR, and we developed a professional development strategic plan, and a week 1 orientation for new employees. So we're going to finalize that, and we're going to start rolling it out, making sure that new employees get connected. They know the different departments. They know where to go, locally in the area. If there's any trainings that they need to do, we can get all of that out the way the first week. If they want to be an interpreter and they want to take the test, we want to get them ready for that. So we just want to make sure when people come in, they're getting an understanding of everything that's offered to them. We just recently did a DEI style training in honor of Mental Health Awareness Month, about the psychological effects of racism in the workplace. It was a really cool webinar. We had a discussion. And since then, a lot of the staff that came to that we've had a lot of discussions about trainings, that people want, and people came forward about things too. The wonderful thing about that training is people started to come forward and say, hey, I'm actually thinking there are some things that, I want to work on in my department. So it was a success. It was a really great training, and it also made staff aware of some of the mental health support that is available to them through our employee benefits. And then up and coming, we're scheduling now some safety training. So I'm working with PD and fire to schedule some safety trainings around active shooter and that kind of thing. Just thinking about everything that's going on, we want to make sure that we're prepared and we have our plans in place. And then we have some anti-bias trainings that are going to be coming up. And I've been sitting in on interview and scoring process for hiring new employees. And so that's been great too, just making sure that process is equitable, and that we're also bringing in diversity, bringing diverse candidates into the city. And then I've been a support for a number of employee relation issues, especially with staff who identify as minority. So a lot of staff that identify as minority, find that my office is a comfortable place for them to come and talk about things. If they need support with mediation, if they need strategies, my office has been available for that. And I actually hold office hours Monday and Thursday from 11 to 2. So feel free to stop by. And then I want to talk a bit about the Equity and Justice for All Commission that, you know, I want to roll out from the DEI office. And so this commission, it's going to be an internal commission that's going to review city internal policies and procedures and culture for the purpose of advancing diversity, equity, and inclusion, and creating spaces that celebrate diversity and foster community and belonging inside City Hall and government. And so this commission is going to review the procedures and practices that also involve interface with the public, such as town council and other public meetings. So it's the internal stuff in City Hall, and then also how we are interacting with the public and what our policies and procedures are for that, making sure it aligns with our DEI focus. For this particular commission, we nailed down the commissions that we want to have representation there. One would be the BET, the Board of Health, the Commission on the Status of Women, Housing Authority, Fire, Police, Planning and Zoning, and then Transit. And then just to kind of, you know, go give a little context on how the commission is going to do this. The first part is assessing the affirmative action data, because we do collect affirmative action data every year. And I've, you know, been putting together a report for that. So I have that. I have a breakdown of each type of job in City Hall, and then, you know, the men, the women, and broken down by different races. And I'll share a couple of those data points with you in a minute. But we'll be assessing the affirmative action data to determine trends that support the strategic plan of the DEI office and the city's commitment to equity and inclusion, engage with diverse communities within Norwalk City Hall and government to gain and share insight and feedback related to those internal policies, procedures, and culture related to our commitment to equity and inclusion. And then assessing the efficiency of the DEI initiatives and making recommendations when necessary. You know, I do see that as a really important piece of it, being almost like that oversight for the DEI office, right? And making recommendations, because these people that are part of the commission are going to be eyes and ears, you know, in these different spaces, and bringing that back so we can be intentional about what we're doing. And so I'll stop there, just see if anybody has any questions about anything.
Just initially, thank you very much, Latoya, for the presentation and the information and what you're doing. I mean, the language stuff is great, and I think the Babbel subscription idea, that's fantastic. And the youth work that's going on, that's great too. I do have one quick question. When you're talking about the commission from those different subsets, you're talking about a representative of each of those, like the chairman of each of those commissions would sit on this commission?
So it doesn't need to be the chairman, because we also still want the commission to be diverse. And of course, we need everyone there. We need everyone there. And so the commission can decide who from that commission can commit to that. I think it might be a little too much to ask the chairs to take on being low key, like they're all going to be chairs in their own right on that commission. So it's almost like taking that on double time. So you don't want to do that. But the commission makes that decision around, you know, that chair being the best person that can, but I think they should come together and decide who's the best person to represent us in that space.
Okay, great. Ms. Revolus, you had a question?
First of all, I just want to say you are doing amazing work. And when you said you heard something, I apologize, but I was just like, when you were speaking, I was like, Black and brown. That's been an issue for a while. Black and brown children who are getting expelled and exorbitant at different rates than their counterparts. Also, the language, like there's so much of this that I, not only if I could help, but do want to speak to you offline about, but the language part, if you guys know me, I speak of in almost probably nauseum, but I definitely obviously would probably help you in the Haitian Creole space. I do want to say though, if this helps, I do like Duolingo, who actually added Haitian Creole to it, but our library, if you have a library card, you have free access to Rosetta Stone. So I don't know if in
That's
any way
awesome.
that can be helpful here.
Yeah.
Because just like the language line, we already have it, right? So use it. The library, we already have it. Yeah. So if that could be of any assistance from like our town helping us out in, opening that up, hint, hint, to this, so that could be of help in expediting what you're doing. I'm just giving that out there.
Yeah, thank you so much.
Third-
That's really helpful.
You're very welcome. And thirdly, like this is just amazing, and in particular too with the children and that outreach. So I would love to speak to you offline and helping, and particularly with the Haitian Creole teacher.
Absolutely.
And I've been wanting to get to you for forever, but this is our Heritage Month. So this is a busy month too, but I will definitely speak to you too. And you're just doing amazing work. I'm really happy that you're just so passionately enthralled in this and doing it with great intention, with this intention. That's all. I'm a hush up now.
Right.
Thank you. Thank you for
Thank
those
you, Ms.
kind
Revolus.
words.
Ms. Ayers.
Thank you, Chairperson Huberman. I have several questions and some unreadiness. So let me ask this question first. In regards to the presentation of what you presented to us about the commission, the actual formation of the commission, the committee previously kind of let it be vague because we wanted whomever we hired to have some ability in structuring what that commission would look like. And I heard you identify already established entities in the city. Where is the community component to that commission?
Yeah, so I think the first is kind of like a two-part thing. The first thing is that before we go out to the community, and kind of go to lengths with that, we gotta take care of the inside of inside of the house. That's something that I noticed right away. We have to take care of what's going on inside, so that we really can come outside and come correct. And then the second part to that is that part of this with seeing how we interface with the public, that's also part of these people that are representatives in this commission. That's also part of it, is them connecting with people and finding out how are we interacting with the public? What is the public feeling about how the city is moving and their space in it, and bringing that back and thinking about how we can strengthen those policies or get rid of policies that aren't serving us or create new policies that are.
Right, in an impassioned moment.
The second part is,
There we go.
how are we connecting with community? And I think when we can, take care of those two things, then I see us, in the future going to the community and forming a space with the community. But here, these representatives are going to have to, they're interacting with the people. They're going to have strong ways of interacting with the public to get the information that we need, to do this work. So that's where it comes in. So it wouldn't limit it to just having some people from the community on the commission. No, these representatives are going to be talking to the community, at large, to get that feedback around how we're interacting with them. So I was just thinking it's just a way to reach more people, rather than having, a few community folks on there.
I would caution that this community has been waiting a substantial amount of time for this commission, a substantial amount of time. And many people, I'm sure there are people in City Hall who are giving you the necessary information you need. But the community at large, particularly underserved people, have been waiting a substantial amount of time for this commission. And I do respect and understand your position of not just wanting to handpick a few people to represent the whole collective. Again, I got a kind of little pushback a little bit on that, because we worked very hard, most of us, to make sure that the community had space, and they're waiting for us. We're not waiting for them. The community is waiting for us in this commission that has been on pause. I want to say 2 years, but my timing might be a little bit off. It's about 2 years. So not that you're doing anything wrong. Your vision is your vision. I just would friendly like to nudge and say, I agree with you. You do have to make sure your house is correct. I do agree with that position, but not to have community as more of a forefront in the commission, I think is problematic. My personal opinion. Other people can weigh in. Additionally, I think I was intentional of not bombarding you in your first month here. But I do think that there is some things that you are doing that is outstanding. And I do applaud you, Ms. Fernandez, but I want to make sure that we are not reinventing the wheel. The city of Norwalk is rich with resources, and we have providers that do really good work. And I love the partnership that I'm hearing, and I'm loving the connecting of people. I think that's very important in community, but I also want to make sure that we are not making subsystems to alienating people who have been doing the work and who have been doing the work for decades. But again, I applaud your efforts. You have a big hill to get up, but I have all faith that you will get up that hill and bring us with you. I just have a little concern with where we're going from what you have shared with me.
Okay.
Thank you. Nicole, is that all?
For now, I think the committee really does need to go back, either look at old minutes, recordings, the original document about that commission, but I think that's committee work. Because we're kind of far from where we were. But maybe Barbara or Greg, even you, David, you were on the council when this originally came through. You might have some different perspective or input.
Okay, thank you. Mr. Burnett.
Thank you, Chairman. Two questions and a comment. My first question goes back to Deanna and team. As it relates to the COVID crisis being, I guess, officially over, are we going to send any kind of communication out to the city of Norwalk to let residents know, or are we going to just go by what we hear from the state, federal government as it relates to COVID?
Thank you, Mr. Burnett, for the question. So we, Teresa's been working with Michelle, with Matthews, on updating the website. So that's been going on. And then we've also been in discussion with the mayor's office with Michelle about potentially putting some communication out. So we have been discussing it with them. But if anything does come out, it'll come from the mayor's office and, in collaboration with the health department.
Great. I think that would be helpful just to, provide clarity to the community that, we're moving on at this point, and, what that means when we say the COVID crisis is over. So thank you. One question is to LaToya. When you're going to list of entities that would be part of the commission, maybe I heard different, but I thought you mentioned the BET. Did you mention the Common Council at all in that list?
No, we thought about it, but we were like, no, there's no Common Council doesn't really serve on, the other commissions, to my knowledge, right?
No, but that doesn't mean they can't. If I can make a friendly suggestion to consider the Common Council as opposed to the BET, there might be representation. We obviously have a very vested interest in this commission. So just a suggestion to consider either substituting or adding the council to that list. And then finally, just want to state, you mentioned the language class. I did participate in the Spanish class, and most importantly, it was fun. The instructor made it so much fun. You go in there and you're in a Zoom screen like this with other colleagues, and most of the time you don't have answers, but everybody helps everyone out, and they don't laugh at you when you put something wrong. Help each other. So it's supportive, collaborative, and the 6 went by so quickly. I think everybody wanted another 6 weeks because everyone was just starting to hit their stride where they could put together a sentence, and then it was over. So, but congratulations on a great effort. Looking forward for more sessions.
Thank you, Mr. Burnett. I will say that, to go back just for a moment about the commission, the next step with this is going to be it's going over to the ordinance committee, and we're going to craft the language of it. So we're going to have more conversations. We want to craft the language of the ordinance that will create the commission, and then bring that back to this committee as well, and then back to public hearing through ordinance before it's finalized. So we're going to have more discussion about that. That'll come back through us. So, Ms. Smith.
Thank you. Yeah, I actually, I had something, but I am going to just jump on something that Greg said. I actually kind of have a different perspective regarding the BET and the Common Council, because, we engage with the community. We're elected by the community. We engage with the community. We're out there talking to people. We hear people, but the BET members are appointed, and they're, I think they're much more isolated. I think, just in general, like I wouldn't speak, for individual people, but I just think, but just by the nature of their appointment, I think it's a good idea to have a member of the BET. That doesn't mean it's not a good idea to have a member of the Common Council, but I did just want to make that remark. But also just to piggyback on Nicole's comments, and this has been going on for a long time. We've been waiting a long, long time for this commission. We've been talking about it for almost 2 years. So, I agree with Nikki that the community's really been waiting, and there's been a great deal of frustration. But the one thing I will say is, in my conversations with you, LaToya, I'm incredibly impressed by how you are engaging with the community, and you're out there. And so you're asking the questions of the community, of what the needs are and what are the frustrations and what really needs to be done. So I guess I'm at the place, and I will be honest that, when I first heard you, talk about, which people you would invite first on this commission, I was like, oh, that wasn't what I was expecting. So I had to take a step back there and just look at the wisdom of it. And, just in my interactions with you, I'm, I guess I'm in a place where I trust the expertise you're bringing to this, and just ask, that you keep in mind some of the comments that Ms. Ayers just had, and the frustration of the community, that community engagement is so important. And I know I don't have to tell you that because of our conversations. I know I don't, but I just, want to just make those comments. And thank you so much, because you're just doing an incredible job. Thank
you, Ms. Smith. I have the same thing to say. You're doing wonderful work, LaToya. I'm so pleased that you're here, and so happy that you're here, and look forward to more wonderful things. Ms. Revolus has raised her hand. Go ahead, Diana.
So I have a bit of a question, because Ms. Ayers brought up something that I kind of forgot, but she brought it up, So how do you, with the commission, if you don't have some type of community member there, to be the expression of what the interaction is in the perspective of the community, to engage and have the mental reframing happen for the structures within. How exactly would that happen without a community member? Meaning, like, how do you see that without the inner workings being with some type of community member that then helps pursue the process of the engagement to a greater whole of the community? If
Yeah.
that makes sense.
Yeah, no, it makes sense. No, I think like I get it. You know what I'm saying? I get what you're saying. And I think it really is, for me, I see it as, this commission connecting with the community intentionally, like intentionally listening to people, right? Intentionally having certain groups that you're listening to about these things and bringing, because what we want, this commission needs to be intentional. In order for us to be intentional, we have to be specific. What is this specific group saying? What is this specific group saying? Because one of the things in our communities, especially in our communities that identify as minority, is that we're not a monolith. So one of us cannot speak for all of us. And so it's important to have a space where everybody who in that group who wants to speak has an opportunity to share. And then we bring it back to the commission in an intentional way from these different groups, from these different communities in these different areas, because there's different levels of this in these different areas, right? Like how people are, how people are interacting with police officers, and that's its own thing, and then and then there's what's happening inside of City Hall, how women are feeling they're treated, pay equity, promotions, things like, so there's all these different buckets. So we want to be really intentional with the grouping. You know what I'm saying? And that's not to say in the future, like, because it's not to say in the future we can't think about other ways to engage the community and certain community leaders in Awareness Commission, but I just feel like we gotta get the internal workings and how we.
So I hear you. So okay, one, because you took it. That's why I was like, get out of my head, because for example, this is one of the questions I used to have, or still do, but the police have the police have engagements that show, for example, how it's like for them in interacting with the community, right? We've been able to go through this, it's been open and it's quite open-eyed. It's, you get to see the perspective of the police. But I would always ask, do you have the concept of showing the perspective of the community's engagement towards you? That still doesn't happen, right? So in that same space, maybe even if there's just like the commission itself doesn't, but where then is a practice or a presentation or a orientation of sorts that then brings in that type of interaction that then shows the perspectives of the residents, our constituents towards those who are going to help. How does it feel to them? Maybe if it's not them yet, have that engagement in a sense that brings it their perspective to that training, to that story, to that ideology, right? I don't know if that can possibly help, because it's like, just show that other side of the coin and give that a voice too, because that's a whole different perspective. And one of the things that I loved, and why I said Black and brown, right? Because if you have intention, we've talked about that so many times, so many years, for so many times. We know that in Norwalk, but we don't address that with intentionality to stop it, right? Like, the intentionality of having that engagement is to see the other side of the coin. So if you can have a way of presenting that in a way, if they're not there around the table, they're a present. I don't want to sound like a presentation, like they're objects, but if that makes sense, it's an an open monologue between the two in some type of coarse manner, if that makes sense, like in a mock manner.
Yeah, that totally makes sense. That totally makes sense. And yeah, I love what you're saying. And we are 100% going to make sure that we're hearing from people. And I'm definitely going to consider everything that you all have said, because, you know, there's history here. And I appreciate, you saying that you trust me, because I think I've thought about this long and hard, and I've done this work before, and just thinking about being strategic and intentional about doing it, and making sure that whenever we do decide to create something, and we're bringing the public in, and we're saying that they can lead a table, we really got to make sure we are coming correct to people with a system and a platform that is solid. And I think we'll be able to do that with the commission. Another thing that will come out of it is that this information that's going to be brought up, and to your point too, Diana, is that is we're going to be looking at our policies and procedures. As we're hearing these things, we're going to be taking a look at these things. So it is with the full intention of making the changes necessary, that align with our commitment to diversity, equity, inclusion, and belonging. So that's the whole point of it, is like, we're going to get that information, and we're going to figure out what we need to do, to get there, to align with this mission.
Thank you.
You're welcome.
Chairperson
Excellent.
Human,
I'm sorry, go ahead, Nicole.
can I have a point of clarity from you? You stated that the process is that the formation of the commission is going to ordinance. Did I hear you correctly?
Yeah, the writing of, what is now the Human Rights Commission ordinance, which has not actually met, I believe, in almost 2 years. I don't think it's fully, it has fallen by the wayside. And the reason is it was written before that particular commission was before the CHRO was created by the state of Connecticut. And so that was the way that communities at that time were dealing with issues that the CHRO now deals with. And so we're going to take that commission, and with LaToya's help, we're going to rewrite it to reflect what's been talked about here, ideas that will come up based on the conversations that we just had. And we're going to craft what the structure of that commission looks like. Then we're going to come back and have another conversation about it before it goes to actual public hearing and gets brought before the council. So we have a number of steps. We're at the very beginning stage of this.
A few things, because I fought for this position. I fought for this position. So my confusion, I guess, is the previous chair wrote some type of document that was supposed to be sent to ordinance. Do we have that?
Yes, it's been shared. That's been shared with me, and it was shared to LaToya and to Lamond and others. Yeah.
Is it possible that the committee can see it? Because the committee didn't see it.
Oh, I was under the assumption that had been seen, that would predated me. That's why I asked the question. I didn't know that.
No, the committee never see. So
It was never fully fleshed out. It was basically it wasn't a fully fleshed out document, if that's what you're asking, but I'm happy to share it with you.
Okay, so whatever the form of the document, I think the committee should see whatever that work was, because some people inputted on that work. My second part of it is, I'm going on record. I'm gonna say it. Not that you don't have to work with the already formed departments of the city. That's not my pause. That's not my concern. But as a minority, as a person underrepresented, however y'all want to title things, it's a system. You're talking about a system, and you're talking about making an ancient system fair and equitable for everybody. And I have some concerns about us now creating a pseudo system in the larger system. And if you're saying, oh, it's going to go to ordinance, I really think we should put a document together and send it to ordinance so that they have something to work on. But it seems that you want to take it another direction. I'm really struck by this because this was not always the popular thing to do. Some of us had to fight to get to this. And now it's seeming like, well, we're going to let another body work on a document that was not their passion, was not their work, without us presenting a document. Am I making sense?
Well, the document is the Latoya and her department is who is creating the jewel, the gem of this, the germ of this, that we are then going to go take the legalese in the ordinance committee and craft it into an ordinance. What she has been describing tonight and talking about tonight is very different than what was written, that was the musings that were written before, it was incomplete. It wasn't a complete document in any way, shape, or
So
form.
I get that it was not a complete document. I hear that. I get it.
Right.
But you just said that what she presented was totally different
It's very different, yes.
than where we were. But again, that committee work, the committee was not brought on along the process. And so what I'm asking for is the committee to have a opportunity to basically catch up, because now we're creating something totally different than what we even commissioned. And so am I to understand, and I could be wrong, but am I to understand you're saying you got to take this new form because this is just where we at, without us even having a part in what that new forming is?
Can I make a recommendation here?
Yeah.
If you don't mind. I think that, just to go back, I believe, with Dominique, when Dominique was here, what was talked about, and this was before Latoya was hired or around that time, was that the committee chairs were going to get together, Dominique and Lisa Shanahan were going to get together and start to
Yes.
flesh out some ideas. And then there would be a joint meeting. And so I think that, once the ideas are fleshed out for the committee, I think, or for the commission and the ordinance, then we need a joint meeting of our two committees so that we can have a full update and provide feedback.
Which is ostensibly what I'm saying. There isn't anything to look at right now because it hasn't been written. There are what Dominique had written down and what had been done ahead of time is literally musings. I don't know. That's the best I can describe it. It's not a fully written document that shows an ordinance that we can have a discussion about structurally how it will work, and from an objective standpoint, and also then from a subjective standpoint, if that makes sense. So we're that's why I said we're so much at the beginning of this. We want to have something to be able to have this discussion that you're talking about, Nicole, and we don't have anything to actually have the discussion about because it's not actually written yet.
I'm sorry. I'm
Oh,
sorry.
that's okay.
No,
Yeah,
I
you're right.
understand that this is the beginning of a discussion. I get that. And I know ordinance takes time. I get that too. I guess I have to wait to see what is presented before we go. I just have to wait to see what's presented at this point. So if the next step is for the ordinance to actually be written, then I have to wait and see what that looks like.
Which is Ms. Shanahan and I are going to start writing the language of this, and then it's going to come back to this committee. It'll go back to ordinance. Eventually, when we have a consensus, it will go to public hearing through ordinance and then go to the common council. But as I said, I know it's been 2 years and we are wanting this, but we don't want to do it. We want everybody to have input, and we want to be able to have these discussions around it. Does anybody else have any other questions? All right, well, Latoya, thank you so much for your work and for the presentation tonight. And we look forward to the continuation.
Yeah, absolutely. You're welcome. And I just want to say, I'm available. Anybody who wants to meet with me can meet with me. You know, I've been here a little over 6 months. Email me, call me. We can always talk. I am always open and willing, and we'll make time to sit down and meet with people. So please don't hesitate to reach out to me.
All right. Thank you.
Thank you. Bye.
All right. Moving on to presentations by Ms. Anna Vivian Estrella, Human Services Director. Thank you.
Good evening, everyone. We have gone over in time, so I'm going to breeze through it. But a lot of you have already had the opportunity to hear about the Community Resource Hub. So for a history lesson, this was the merger of the Family Navigation Program and the Community Resource Specialist in an effort to have a cleaner message for the Norwalk residents so that they don't get confused. And we launched this and did the press release last summer. So I'm happy to come here tonight and kind of go through the presentation, but please feel free to stop me at any point to ask questions. Let me just share my screen. Can you see the presentation? Okay, perfect. So I wanted to just do the title page because this is the signature look. We tried to make sure that everything was consistent, that the colors were consistent so that the residents would be able to identify the Community Resource Hub. And again, just to streamline messaging. And then I just put in the website. So you can go on to Community Services. It's still not perfect, but you can actually see the Community Resource Hub information there, and there's a link and there's a way to refer people through the city website, because it was also really important to make sure that even if people aren't ready to take the flyer or they're not ready to make that phone call, they can peruse the city website and get that information from there and self-refer. So with the Community Resource Hub, the way we really set it up was, imagine you don't know anything about social services. You might be a concerned friend, a primary care doctor, a new resident. It might be your first crisis. So we developed the entire program around the purpose that the staff here is that we are here to help Norwalk residents identify, understand, and navigate available resources and services. So this is us becoming a bridge to all the great resources that Norwalk already has, and really providing that care and that information that will get the residents to what they need. The ways that we help is that we're open to all Norwalk families. And so there isn't a burdensome intake process. It's a very quick referral process. And we've made it a no wrong door approach. So people can walk in. Well, I'm getting ahead of myself, but we have bilingual staff. So we're very purposeful to hire staff that speak multiple languages. We have staff that speak Haitian Creole, Spanish, Italian, Albanian, and English, of course, and they're flexible. So we've set up our policies and procedure to be as accessible to the Norwalk residents. So if they want to come in person to see us, then we do it that way. If they need to text message, we make our way through text messaging, email. Really, we've just tried to make ourselves as accessible to those that are seeking the services. And we go based off of what they need and what they're looking for. So if they come in and they say, we just want a number, we can handle it from there. We just wanted a human to talk about what we needed, and I just need that phone number. That's what we do. We don't push any further. We say you're more than welcome to come back, but we are really just there as a support to them, and we let them guide the entire conversation. But we're always there, and we're always just saying that we can always help them with any other needs that they identify. So even if they just came in for that one number the first time, they can always come back, and we'll continue to help them, and we'll help them through the various steps just to make sure that they make it through the door. We also create individualized contact. So sometimes people come in and they've already gone through all of the resources, right? And so we have to get really creative in how we help them address their barrier at the moment. If they've already exhausted all of the funds that are in the community, is there a way we can look at their budget and change something else, right? Help them with clothing so they're not spending their money on clothing. And so that way that frees up money to go towards utilities. And so really being conscientious and taking that path with them and that journey with them, so that if they have exhausted resources, or if there is no resource in Norwalk to help them with that particular case, we can help them wiggle in other ways so that their needs are still being met. We follow up and we just make sure that we do all of those steps. Now, I have examples up on this screen, but I'm going to preface these examples that I don't want you guys to get hung up on that this is the only way we help, because it really, really does look different for every single individual and every single household that comes through our doors. So 2 examples just to give you different variations of the way that we help. We had someone middle-aged, head of household, their car broke down, they ended up with a huge bill and they were unable to pay their months of utility. They really didn't know what to do, right? They had spent their money to fix the car and now they came in, they had never needed these services before. The navigator's role was to refer them to Alliance. So City of Norwalk, we have money that goes in different places, but we're not the place where they're going to get that utility assistance, right? We're not, the City of Norwalk is not the one signing that check off. Alliance is, and they're our partner in this. And the unique piece is that we're not just saying Alliance and here's the website. If they need it and they want it, we're saying you're going to go meet with Karina at Alliance, right? There's a name associated with it. This is what they're going to ask you. This is how it's going to feel. It's perfectly normal. And this is what your expectation will be. So that way they're not thinking, oh, I'm going to get the check today, or they're not caught off guard by the paperwork that they have to fill out in order to get the assistance. We try to prepare them as much as possible for the experience that they're going to have when we refer them off to the other agency. And really the result of this was that their acute need was met, right? This was nice and clean, utility assistance. There was a utility assistance provider and their need was met. The second example was the head of household passed away. The surviving spouse was only working part-time, and now they found themselves in a position where they could not meet their family's household needs. That's a lot of complicating factors because it's not just the finances, it was the arrearages in rent, it was after school care, it was wage increase, so it was for workforce development. So there was a lot of different things happening at the same time and different agencies associated with it. So person to person helped with the financial assistance. We used the after school portal to get them to the after school program information, and we referred them to a workforce partner. In this case, I believe it was Open Door Financial Center who we handed the case off to. And so that can get daunting for people seeking services too, right? They're going to 3 different agencies, filling out 3 different intakes, but we helped them kind of prioritize. We helped her figure out which one was more immediate, and step by step she was able to get there, but we were just there as a support and a resource as she was going through the different processes. Do you have any questions about the examples? Because I know that I have a tendency to talk quickly. Nothing? Okay. Ways to connect. So phone number, I know you guys have all heard Lamont talk about this, right? The phone number, 203-854-7999. This used to be the phone number for community services, and then you had to hit a prompt. Through all of the feedback that received, this is actually now the dedicated line for the Community Resource Hub. So they don't have to select a prompt. It goes straight to all of the workers, and so everyone as a team picks it up and addresses it online. So you can use the QR code that we add onto the flyers and all of our printed material, or as I mentioned, you can go on to community services on the city website and you can get to the referral platform from there as well. Or you can walk in. So we always have staff here 9 to 5. Really, it's more 8:30 to 5. And they're always ready, willing, and available to help anyone who walks into the office. So we get a lot of referrals from customer services downstairs, the security guard, other departments. They'll just send people down here if they ask a question that's kind of outside of the scope of whatever their department can address. The other piece that we've been able to introduce this month actually is that the navigators are sharing an office with one of the NPS staff members in the family center. So on Thursdays, we have staff that go over to the family center to help families there as they enroll, to see if there's any additional services we can refer them to when they're enrolling their kids or when they're interacting with the school staff through the family center. These are the initiatives that have happened within the last year. So like I mentioned, we try to keep everything in line, same colors, nice and clean, informative. So these are 3 different types of printed material that we put out there. The traditional flyer all the way to the left, the middle flyer we kind of gave to providers, and the flyer to the right is an infographic just to show people the path of how the Community Resource Hub helps them. And then the other pieces that we do is community meetings, community presentation, and community events. So we make ourselves as available as possible to our partners. And so here's some pictures of the staff at various community events. And just to give you a scope of how many events we've attended, in the last year, there's been at least 18 community events, and we've done at least 5 presentations. And so those are as requested. With all of our partners. A lot of them have been local, 99% of them have been local, but we did get invited to some regional events, and we thought it was important to showcase what Norwalk is doing and make sure that our providers that don't have a brick and mortar Norwalk still know that we're here to help any Norwalk residents that are within their catchment area. So our impact. As of last month, because I didn't want to add May numbers, so as of the end of April, we had assisted 613 households, and that totaled 1,672 individuals impacted. When you break it down of what kind of individuals are coming into the Community Resource Hub, 74% of them were first-time seeking services. So they had never needed social services before. This was their first time really requesting help or identifying that this was their first time requesting help. So that just goes to show that, you know, people come to City Hall looking for that assistance. And we didn't have that before. So this is really special. And the top areas of need, I'm sure there's no surprise here: food and clothing, housing, and employment. So our outcomes, we have an 83% success rate. The rest of them are when people get some information, but then they disengage. So we don't know if they actually received the service, and they have no obligation to pick up our phone call, right? But we always make it clear that they can come back in voicemails or emails, whatever modality we were communicating with them. But we do have 83 confirmations as far as success rate. The feedback, when we have been able to do the survey on those that we assisted, 91% of them indicate that they feel more informed. 42% feel like they know how to access the resource. But if we go down, sorry, the screen is blocking the percentage. 93% are saying they're confident they can connect to the services once we've helped them. And then this is just a quote: "Thanks to you, we're finally in the right direction," or sorry, the screen is blocking it, in the right place. And that was a conversation where a family indicated that they had a adult child who they felt like maybe they had always needed additional services, but they didn't do the evaluations. They hadn't done any of the support systems. There wasn't an IEP in place in school. There hadn't been all of these things that might have helped. And so now as an adult, they needed additional services, additional skill building resources. And so they felt like through all of these referrals and all of these connections, they were finally heading in the right direction to getting their child the appropriate assistance. And then thank you. So like I promised, it was short and sweet, but I hope it was really informative, and I really want to open it up to any questions or anything that you might be thinking, comments, feedback.
Anna Vivian, that was wonderful. I am so excited by the success of that program and what you guys are doing, and just seeing the metrics. That's just great. Kudos to you. I mean, really, I think this is just amazing. Ms. Smith, your hand raised.
Yeah, I mean, just to really reiterate what you're saying, David, Anna Vivian, you are doing amazing work. Our residents are benefiting so much by the work you're doing. I think you're brilliant. So thank you so much.
Thank you. And it's not me, it's the team, right? I inherited some staff members.
You bring some pretty amazing data skills, and just you're terrific.
Yeah.
I know it's a team, but you bring a lot to it.
Thank you.
Mr. Burnett.
Thank you, Chairman. I guess my question is, Anna Vivian, are there services that are being provided at the Family Center that if the Family Center did not exist, you would be able to cover those at the community hub? I'm just curious to understand the level of overlap that might be in existence.
So we have presented at the Family Center, and we've had conversations with them about what they do at the Family Center versus what the Community Resource Hub does. I don't know if there's a lot of overlap, to be honest, and I don't want to necessarily misinform this council. My understanding is that they do family registrations there, and they kind of deal with the academic pieces, and then they have the next step, right, which is the school that continues until the students are 23. Those are all things that we wouldn't do, right? The social services pieces that they've introduced into the Family Center, I think that they saw that we were a partner and an appropriate partner for them to do the referring piece, right? It doesn't make any sense for their staff to reinvent the wheel of what's happening at the Community Resource Hub. And that's why we were invited to be there once a week. But like, they do a pantry. I wouldn't suggest for us to do a pantry out of City Hall, because our entire model is based off of there's somebody else doing it, right? Open Door has pantries. And so our job is to shepherd those that need that over to Open Door, or the food resource guide that the health department puts out, as opposed to us providing a mini version of that service. And I wasn't a part of the thinking of why they started doing the coat drives or the pantries. I'm sure it was just to kind of help band-aid it for that immediate need until they got to those resources. But that's not something that we would necessarily do at the Community Resource Hub. I don't think it's the right messaging, because we're never going to be able to fulfill that need to the appropriate level. But NPS is working with a subset, right? We're open to all of the Norwalk residents. And so there's no way we'd be able to manage everybody who needs food today to come into a pantry that we created inside of City Hall. So I just think it's different. And I know that's a long way to answer your question, but we'd have to look at it, right? And we'd have to say, okay, let's sit down, let's be strategic about it. What's appropriate, what's not appropriate, what can we scale, what can't we scale? And I'm just not as intimately knowledgeable about everything that they do at the Norwalk Family Center.
Great. Thank you, Anna Vivian. That was wonderful. Are there any other questions from the committee? All right. So, and you have another piece?
Another baby presentation. And as you can see, I can talk really quickly. So let me just share my screen. This has to do with the Norwalk mini grant. Okay, can everyone see my screen now?
Yes.
All right. So the Norwalk mini grant, the key features is that it's 5 to 10,000 grant amounts. So these are smaller amounts and it's targeted to smaller nonprofits. So maximum annual budget is 1 million. And the requirement is that they have nonprofit status for at least 2 years. And then the total allocation is going to be 100,000. So we're really looking at, 10 to 15 applicants receiving these funds. It's going to be project-based funding to support the local nonprofits, and it is a modified application process. We tried to make it a little friendlier, acknowledging that a nonprofit that's maybe 2 years old may not have as advanced of a structure as a legacy nonprofit. And so we tried to be as conscientious about that as possible. And Lamont has talked to Fairfield County Community Foundation to provide in-kind support so that those nonprofits have access to some development tools and someone to be a resource to them as they go through this process as well. The application process. So it is going to be focused on health, education, and safety net. Those were the big ones that came up through different data points and through the ARPA funding. And so that's where it's going to be addressed. And then the data that we've requested that the nonprofits develop in advance at the application process is anticipated individuals served. So a breakdown of adults and children, anticipated impact. So what is the increase or decrease of the identified community need or gap? And we've created a little table so that that's a guided conversation and provided an example, and also the grant budget, because it's grants and we need to know how they're going to use the money. The scoring is very typical. So we're going to have a review panel of 3 individuals, and they're going to look at each application. 20 points are allotted to how well they did, explaining the need that they're addressing, the focus of the grant, the fiscal components, and the sustainability is 15 points. Evaluation is 10, the priority is 10, and innovation is 25. So I just want to point out that we did do a heavy prioritization on innovation, right? We're trying to make sure that we're not duplicating or replicating. Really, how is this innovative? How is this different? And who are they targeting, so that we can prompt new resources in the city of Norwalk. And then the follow-up, the reporting, we've asked them to just put in a text box of the project description, population served, goals, impact progress, success stories, roadblocks, so that we can see if there's any way we can help further along the way the funds were spent. And to plant seeds for smaller nonprofits, we're asking them to outline any sustainability efforts that they've engaged in, so that we make sure that they're keeping that at top of mind. And then I think that's it. So yeah, like I said, small presentation. Any questions about the mini grant program?
When are we planning to launch the application process? Do you know?
I think next week.
Next week.
Yeah, so we were hoping to launch it on the 15th, but we wanted to make sure that we had the opportunity to sit down with Michelle so that it gets promoted on our social media, our Facebook, on the website. And then also Lamont's going to make sure that it gets presented at the next community provider meeting. And so we're just trying to be very strategic so we know in advance where we're going to plug in all the communication so we don't miss anybody, right? Everyone gets their information from so many different places.
And how long are we planning to have the application window open?
I would be lying to you if I told you I knew the answer to that question.
All right. No, that's fine. That's fine. Are there any questions from any members of the committee? Seeing and hearing none. Thank you, Anna Vivian. That was great. And just looking forward to all of it. But again, the Family Navigator and the data, that's incredible. And I appreciate so much. I think the whole committee does the work that you guys are doing. So let's move on to action items. And these are health department action items. And I see Ms. Diamore has returned from the off-camera world. Number one, authorize the mayor, Harry W. Rilling, to execute a group purchasing participation agreement together with any and all other agreements, documents, instruments, or amendments required thereunder with Vera Medical Group for purposes of cost savings in medical supplies and equipment. Can I have someone move that item? Thank you, Mr. Burnett. And Deanna, go ahead. Yeah.
Sure. Thank you, Chairman. So we're in the process of updating our exam rooms. It's a capital project that had been delayed because of the pandemic, but now we're getting back to making the upgrades. And through this process, Carla Rodriguez Alicia and Darlene Hoffler realized that we're working with Henry Schein, and they presented us with the opportunity to join their group purchasing organization. And so what it's called a GPO. What it does is they create contracts with manufacturers and distributors to get lower than market costs. And the great news is we already order a lot of supplies from Henry Schein. So we've anticipated that if we join this GPO, we'll be able to save $6,000 in our exam room upgrade, and potentially additional savings moving forward in the future with other medical supplies. So we thought this was a great opportunity for us. We presented this to the purchasing officer, and she agrees that we should move forward with it, as well as our CFO. Henry is also recommended and is supportive of us becoming part of this.
Well, we always like to hear about things that are going to save us money, so that's great. Are there any questions from any members of the committee? Seeing and hearing none, I will call for the vote on this item. All in favor, please signify by raising your hands. And Diana? Are you in? Is that a yes?
Yes.
Yes, okay, great. And that's unanimous. Thank you. So item number 2, authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary with Health Information Alliance, Inc. Connie, to connect to and join Connecticut's statewide health information exchange, or HIE. And I guess this is you again, Deanna.
Yes, it is. Thank you. So the state of Connecticut has established a statewide health information exchange, and they're mandating that all healthcare providers join onto it and are able to connect and share health data electronically. So as you are all aware, the health department is a licensed healthcare facility, so we are mandated to join. And so this will allow us to have access to, as a healthcare provider, we'll have access to health information for patients that are relevant in order to make sure that the treatment is ideal as possible. So we would only be accessing information that we would need, only relevant at the time. But, it's a way to share electronic health information securely, and it expands information available to optimize care for patients across the state.
Is that specific health information? How does that interact with HIPAA?
So it's the electronic health record. So it's people that are, it abides by all the HIPAA principles. Okay. Yeah.
Are there any questions from any members of the committee? Mr. Burnett.
Thank you, Chair. Just a process. We did not have a motion to move this item yet.
Oh, sorry, you're right. May I have a motion?
Motion.
Thank you, Ms. Revolus. So any other questions? Seeing and
That's
hearing
hard
none.
part.
Oh, sorry, go ahead, Diana.
Not to harp on what you said, but that's just a really great question. I'm sure the guidelines are being met, but truly, is that in the intention of HIPAA? That was just a pretty good question, but I don't. Can you just explain how that was answered? If that makes sense.
I'm
I'm sorry.
sorry, Ms. Elvis,
Yeah,
can you just repeat that question for
I
clarification?
and not to beat anything in the head to work with me, but our chair really did bring up a great question, but I'm just not sure about the answer that was given. I got it, but I just don't. I don't. I'm sorry. Is that in line with
So
HIPAA and how so?
Diana, are you asking more specifically how
Yeah,
we
yeah,
abide by
exactly.
HIPAA?
Right, yeah, like just
Okay.
how so? Like I'm just because your question was a good one, you know, where they're giving out their personal medical information. Now I would suggest or I would just assume that they're given not to answer the question, but like they're told of this and that they sign to it so that this is released in some type of method. You know what I'm saying? Like how so is it being compliant to HIPAA laws, violations, regulations, so on? Process.
Yeah, I can try to answer that question for you. Hi,
Yeah, I'm
everyone.
sorry. If I'm not asking it correctly, I'm sorry. I apologize.
No, that's fine. The Health Information Exchange has undergone rigorous security reviews and assessment according to the information that's been shared with us, and it conforms with the industry's best practices in security. So all the users are required to comply with HIPAA requirements for privacy and security. So I hope that answers your question.
And Darlene, this is a statewide mandate for all medical providers, correct? So all
Correct.
providers are now have to be a part of this network.
That's correct. All licensed healthcare.
All licensed.
So
licensed medical.
nice, okay. So I guess, okay, you know what I guess more so, but for the individual who would want to know that, I guess I wanted to try to get some of it verbalized. But if it's on a motif of that, you know, this is a national stage, which I get it, you know, and I was just trying to get what are the criteria? What is that? But they would then just probably go Google it or look it up, you know what I mean? But what qualifies this as being a HIPAA verified situation? And I'm pretty sure it's just a signature. Like really, I'm just saying I'm pretty sure it's just a signature, but that's all I was trying to get to be spoken in a sense. That's all, that's fine.
I can also add, you know, you can control whether or not your data, if you want your data shared through Connie to authorize users who have to, there is an opt-out procedure.
Okay, all right. Yeah.
Okay. Great. Are there any other questions? Seeing and hearing none, I will call for the vote. All in favor of this item, please signify by raising your hands. And it is unanimous. Thank you all, everyone. Item number 3A, authorize the mayor, Harry W. Rilling, to execute any and all documents necessary to apply for and accept immunization and vaccines for children COVID-19 supplemental grant funds from the state of Connecticut Department of Public Health in the amount of $295,708 for the period September 1st, 2023 through June 30th, 2025. And I'm assuming B goes with it, so I will read B and we'll move both the items together. Authorize the mayor, Harry W. Rilling, to execute any and all agreements, documents, instruments, or amendments as may be necessary to implement the immunization and vaccines for children's COVID-19 supplemental grant funded activities from the state of Connecticut Department of Public Health in the amount of $295,708 for the period September 1st, 2023 through June 30th, 2025. May I have a motion? Thank you. Ms. Smith moves the item, and Deanna.
Sure. So this last item, we were notified from the state of Connecticut Department of Public Health that there's additional funding available to local health departments that's coming from the federal government to support local public health efforts. And this money is is specific to supporting immunization activities and media campaigns to educate Connecticut residents on the importance of vaccinations and mitigating illness. While it is COVID-19 supplemental grant funds and it can be used for COVID-19 vaccinations, it also can used to support routine vaccinations, such as flu vaccines as well. So it's broader than just COVID-19 vaccination.
Great. Are there any questions? Mr. Burnett?
Yes, thank you, Chair. I'm just curious as to what are our thoughts in terms of how we plan to use the $295,000?
Great. Thank you, Mr. Burnett, for the question. We have a public health nurse that is currently grant funded that we were able to fund through the initial COVID COVID funding. And so we're hoping to utilize this funding to be able to continue her being on the health department in the future to be able to support immunizations in general. We're also exploring whether if there's enough money or not to hire community health worker, community outreach worker, or someone to assist with clinical activities within our immunization clinics. But right now the primary focus will be on supporting that public health nurse who's bilingual, by the way, speaks Spanish and English. She's amazing. As well as additional funding for media campaigns. We're hoping to work with some of our other health departments in the region to pool money together to get the best use of that funds and the biggest reach.
Excellent. Thank you. Are there any other questions? Seeing and hearing none, I will call for the vote. All in favor of moving these two items, 3A and 3B forward, please signify by raising your hand. Opposed? Abstention? Please let the record show that Ms. Revolus abstains from this vote. All the others were in favor. And that brings us to item 6, adjournment.
Motion to adjourn.
Thank you, Diana Revolus. All in favor of adjournment, please signify by raising your hand.
Aye.
Thank you. I believe that's unanimous because I think Ms.
Aye.
Revolus did call the motion. Aye, there we go. All right, thank you, everyone. I know it was a little long tonight, but it was a lot of good information and discussion. We will move these items to the next council meeting and we'll see you all next month. All right, thank you.
Night.
Good night.
Good night.